Exercise 15 deals with the lymphatic system. The lymphatic system is composed of several lymphatic vessels. There are some organs involved and cells that are going to help to carry excess fluid um, back to the blood. Basically, what happens is when the blood is passing through the capillaries and the nutrients and oxygen, etc., all those components are leaving the blood. Some of the fluid leaves, but not as much of the fluid is reabsorbed. So if you did not have the lymphatic system, that fluid would build up in the interstitial space. You would have swelling, and the blood volume, total volume, would decrease. You want to keep it constant. And so you've got to get this excess fluid back into the blood, and you want to filter it because it's been everywhere in the body. It's between the cells, and who knows what's there. You want to filter it before you put it back into the blood. So what the lymphatic system is going to do is collect all of that excess fluid, filter it, and then return it back to the circulation system. The immune system is also involved with this. The immune system basically also has cells and organs whose purpose is to help protect you. It's defense. It's recognizing anything that is not you, and it's going to try to neutralize that or kill it. So that basically wanting to prevent infection and disease from occurring. So with the lymphatic system, what are you talking about? As you can see in this diagram, that kind of that greenish color, that shows all the lymphatic vessels. You do have, in certain areas, lymph nodes. So the vessels are going to drain and pass, connect to a lymph node. So the lymph is the fluid. It's going to flow through the vessel, periodically flow through the lymph nodes where filtration is going to occur, and then eventually it will be returned back to the blood circulation system. So in a capillary bed, your blood vessels, like I say, are coming through. Capillaries are the smallest in terms of diameter of your blood vessels. This is where all the exchange occurs. Roughly speaking, about 20 liters of plasma is filtered out, but only about 17 liters is reabsorbed. So that means you've got 3 liters that's left behind there. You have to get that filtered and returned back to the blood. So that fluid is, once it's in the lymphatic vessel, it's called the lymph. The lymphatic vessel is a one-way system. The vessels are going to start off small, and they keep getting larger and larger and larger. It's kind of like you start at a small farm to market road, then you get to a 2-lane, then a 4-lane, then the interstate. So it's gradually getting larger and larger diameter of these vessels prior to where it's basically dumped or drained back into the circulatory system. It's not a pump. The heart pumps the blood through the circulatory system, but there is no pump for the lymphatic system. So how are you going to be moving these fluids? There are some similarities to veins in the standpoint the lymphatic vessels do have valves, just like in veins, that help prevent backflow. The other thing that's going to help with moving the lymph through the lymphatic vessels are different movements of the body, contraction of your skeletal muscles, and also breathing is going to play a role. You do have lymph nodes scattered about. This is where the filtration occurs. And in some areas, you have a cluster of the lymph nodes. The 3 main areas are the inguinal area, the axillary, and the cervical areas. As the lymph passes through, it gets filtered. How is it filtered? Well, you have a higher concentration in the lymph node of some of your phagocytic cells, cells that will recognize foreign substances. So they can recognize, oh, there's a bacteria, there's a virus, let's kill it. And so that's how it's being filtered. Because one example of the clusters of the lymph nodes, like in the cervical area, all of you have been to the doctor. What do? They always feel along your neck, just under your jawbone. What are they feeling for? To see if the lymph nodes are swollen or not. If they're swollen, you might want to check further to see if there might be an infection. So the lymphatic capillaries, this is where the interstitial areas fluid is going to enter the lymphatic vessels. It's right near the capillary vessels. It is not found in the central nervous system, the bones, teeth, or the cornea. There are flaps that will open. They respond to pressure. So as the pressure increases against it, it will open, allowing the fluid to flow into the vessel. In the small intestines, one thing we see is this is also where lipids and your fat-soluble vitamins can enter. So in this diagram, the green is showing the lymphatic capillaries that are intertwined in the capillary bed so they can absorb that excess fluid. And then this diagram does show right here is a valve that prevents backflow of the lymph, similar to what we see in veins. So the lymphatic capillaries are going to drain into the lymphatic vessels that are going to be a little bit larger. The larger vessels drain into even larger lymphatic trunks, which then drain into lymphatic ducts, which then drain back into the circulatory system. So the right lymphatic duct drains the right side of the body, the right side of the head, the thorax, and the right upper arm. All that will drain, that right lymphatic duct will drain into the right subclavian vein. And then the thoracic duct drains most of the body, the rest of the body, drains into the left subclavian vein. So it's going to be both of the legs, the pelvic area, the left arm, the left side of the head, left neck, etc. Now, there's another structure called the cystinoid calli, which is right below the diaphragm, and that's receiving the lymph from the legs and pelvis, and then that's going to drain up into that thoracic duct. And so this is a diagram just showing the right lymphatic duct in purple and the area that it drains, and then the left or the thoracic duct, the left side that's drained there is in yellow. Your primary lymphoid organs are your bone marrow and thymus. The bone marrow, this is where you have production of your red blood cells. This is also where your B cells, which are a type of lymphocyte, specialized type of leukocyte, white blood cell, that will mature in the bone marrow. The thymus, we've already talked about with the endocrine gland. T cells are going to mature here. The thymus, just so you know, it does, it's largest at birth, and it does gradually get smaller as we age. The T cells will mature oftentimes in the thymus. Secondary lymphoid organs, this is where you tend to have a high concentration of your B cells and your T cells, which are major players with your immune system. It also has reticular fibers that will have macrophages in there. Remember, macrophages recognize foreign substances and engulf them. You have germinal centers, this areas where you have cells that are rapidly dividing and differentiating into the B lymphocytes. And then also you have what are known as high endothelial venules. These are where cells from the blood can directly enter into the tissue. Venules, remember, those are the blood vessels just after the capillaries. So as the blood flows from the capillary, it will go into the venules. They're not quite as big as the veins. Secondary lymphoid organs, things like your lymph nodes, spleen, and lymphoid nodules. This would include your tonsils, mucosa-associated lymphoid tissue that's known as MALT, and bronchus-associated lymphoid tissue that's known as BALT. Your lymph nodes, this is where I mentioned earlier, you have filtration occurring. It's going to remove any, hopefully any pathogens and any debris that may be in that lymph, filtering it before it gets back into the blood. How does it remove this? It does contain macrophages. It does contain dendritic cells, which have phagocytic abilities. It contains B and T cells for the adaptive immune response, that specialized response. Afferent lymphatic vessels, afferent, it's draining towards, into something. So it's draining the lymph into the node. The efferent, it's draining out of the node. And so on this diagram here, you can see a picture of a micrograph or viewing of it under the microscope, and then the schematic drawing of a lymph node. Notice that you tend to have over here your afferent lymphatic vessels. there tend to be more of those, so you have more fluid flowing in than what is flowing out. It's flowing out of the efferent, so it comes in the afferent and out the efferent. You have more flowing in. Now think about this. What's going to happen? If you have more flowing in and only a few exits flowing out, that means it's going to slow down. It's kind of bottlenecks in there, which is fine because that gives a greater chance for those phagocytic cells to come in contact with any foreign debris and attack and destroy it. So it's actually purposely designed this way. Remember, structure determines function. Slow it down so you can recognize, clean it up before it leaves. The spleen. This contains a lot of macrophages and dendritic cells also to help remove any of this foreign debris, cellular, broken down tissue, etc., dying red blood cells. So it's cleaning up, filtering. The spleen, as you can see on this diagram, this is one that I find a lot of students get confused as to where it is. So right here is your liver and then your stomach, and the spleen is tucked away right here, kind of on the side and behind the stomach. Lymph node nodules, these are located in both the respiratory and digestive tracts. Why are they there? Because those are two areas of the body where you're more likely to come in contact with foreign outside substances. Tonsils. You've got the pharyngeal tonsils, or often referred to as your adenoids, those are in the back of the throat. The palatine tonsils, which are on either side of the throat, and then the lingual tonsil, which is on the base of the tongue. And so here is a diagram just showing it. Usually when people talk about having their tonsils removed, they're talking about the palatine tonsils, which you can see in this diagram right here, which are heavily swollen. So they're on the throat. Malt. This, excuse me, is in these are found in the GI tract, breast tissue, the lungs, eyes, and Peyer's patches. Peyer's patches are these little small patches, areas on the small intestines. And then the malt is associated with the bronchi. It's between the bronchi and the arteries.